So we're starting this meeting, which is going to be on autoimmune disorders, part 1 today. And you were with Scott last week and shared a number of things. And I don't know, Scott, if you want to sum up, or if there's any new members, you might have something to say. I'm just happy to be back.
Yeah, so we're covering autoimmune disease, thyroid health, and arthritis. So those 3 topics. That's why we have two parts, because it's a lot of different things to talk about in videos and stuff. But yeah, we had a good class last week, and that's about it. Do you have anybody new to the classes this week? Do we have any new members? Trying to look through the names here. I have to say it was a little more challenging to host by myself, because trying to monitor the chat, look at people raising hands, and then it's easier to have the 2 of us, Charlie, than having just one.
Well, we'll try not to take off too frequently. And after the experience we had, you can just close your eyes, and what do you see about our anticipated travels in the future? You know, we waited for this trip, and then after 5 days, we wind up with COVID. And it doesn't make us excited about scheduling further trips for a while. So I think I'll be around for the classes.
Charlie, can I give you advice?
Oh, sure, Trouty, whatever you'd like to offer.
I personally would not go in an airplane right now, because they eat, they take the mask off, they sit too close together. I do not travel right now till all this stuff is over with, even though I have itchy feet, but I'm not going to do it. Okay. I have COVID and I don't want to have it.
Well, why didn't you tell me that before I got on the plane?
You didn't ask me.
Oh, okay. Now, actually, we did wear our masks, and I don't think I got it from the plane because we protected ourselves, but we did get on with a group, the tour group, in a small van, and there were 13 people in this van, and one of them had a cough, and we assumed it was on the very first day of the tour. We assumed anybody who had a cough on a first day of a tour would either have a chronic cough that they were used to, or they would put a face mask on or cover up when they coughed or whatever. Would you assume that? Well, if you assumed it, it would have been the wrong thing. Because that, I think that's where we wound up getting it.
Charlie, we lived there 10 years, and the people smoke a lot over there. And because of that, the COVID is very, very rampant over there. I have still friends over there, and I'm talking to them. So it's not very good to go over there right now.
You're talking about Alaska?
Yes.
All right. So I want to give you my quick take for those of you who didn't hear it before. Alaska is a beautiful, gorgeous state. It has wonderful nature, the mountains. If you go there, don't expect to see Mount Denali. Only 30% of the population gets to see it, or the people who visit, because it's almost always clouded over 70% of the time. But when we got there, it was totally clear, not a cloud in the sky. And we took this airplane flight, and it was magic. And we landed on a glacier, and wow, what an experience. And the Denali Park, we didn't see one animal for 2 hours. And then at 2 hours, we got to see bear and caribou and moose. And it was like, whoa, this is great. And rafted the rivers and like, okay. And then the COVID hit. But aside from that, what is the food like in Alaska? It is not vegan or vegetarian friendly at all. It is meat and fish and more meat and moose meat and caribou meat and any kind of meat, any kind of fish. And it was a challenge. We did find a Buddha bowl, which I listed on the Instagram. I was so happy to find my food at one restaurant in Alaska, but even at the airport, there was nothing that actually worked with us. That wasn't so highly processed or whatever. So if you really want to stay on this diet, I'm glad we took a lot of our own food with us, because we would have been pretty hungry if we didn't. Just a quick assessment for those of you who are interested in going to Alaska.
Charlie, I could have told you that because of the cold weather, they like the protein.
Yeah. Anyway, it was an experience of a lifetime for us. So does anybody else have anything they'd love to offer before we get started with autoimmune disorders tonight? Yes, Nancy, fire away. Or at least unmute first and then ask or
I
talk.
always forget that. Yeah, I always forget the unmute thing.
Okay.
So I came down with COVID in April, and I didn't even really know I had it because I was dealing with hay fever. So, coughing and a little congestion was, I had that before I got it, because I pretty much know when I got it. It was at a dinner buffet type thing. And then I had a couple days where I was kind of tired, and that was it. The only reason I was going to a meeting with a lot of older people who didn't want to be exposed to COVID. So I thought, well, maybe I better take a test before I go to the meeting. And I had COVID. So, and I don't know whether it's because of my whole food plant-based diet, or whether it's because I, was pretty much up to date on my immunizations, that I didn't get much reaction, or maybe I just don't get much inflammation. I don't know. But
well, Scott can address that about if you're plant-based and the side effects or the degree of illness with COVID.
Yeah, you're 70% less likely to have moderate to severe symptoms if you're on a whole food plant-based diet, and 10% less likely to even get it in the first place. But there's a study published. I actually put it in the review of that study. I can try to find it, but it's in the Eugene Plant-Based Provider Newsletters archives, because I had it printed in that newsletter. But yeah, definitely better off with COVID. Hopefully plant-based.
Go ahead.
And then another thing, I went and got my shingles shot, and everybody says, oh, you're gonna be really tired the next day, you're gonna have sore arm and everything. I had a little bit of a sore arm that night and nothing the next day. I wasn't tired or anything. I just felt normal. So anyway, I attribute it to the plant-based diet. So I don't know.
I had a similar issue with the shingle shot. No major issues. My wife had a little more reaction. Go ahead, Joan.
I just came back from Africa, so that's
so
a lot of plane time, and didn't get COVID on the planes. And also in Africa, I was in Rwanda and Tanzania, and they like to serve beans and vegetables, so it was a great place to go.
Thanks for the recommendation. When we get over our PTSD from this trip, we'll consider that.
Yeah. Well, I went to Africa too, and it was all American processed food and meat and so on. Well, one place they did serve vegan stuff, but basically they just took out the meat and there wasn't a whole lot left. But anyway,
So there's a question in the chat that says, were you both clear for the trip home? As it turns out, the airline industry at this moment in time is not requiring clearing or certification. They're not testing anyone for COVID. So that was not a requirement. We did wear N95 masks so that we wouldn't expose others to us. And we did, after Christine was diagnosed, spend another few days in hotels until she was feeling pretty good and not really coughing to any degree. And I was asymptomatic at that time also. And so that's the answer to your question. Will that change? I don't know, but currently there are no requirements for being cleared. So that's all the more reason to protect yourself if you're going on airplane travel right now. Any other thoughts? This has been a unique start to autoimmune.
Charlie, this is a good idea. You're telling me all these things. I'm going to stay put.
All right. Well, we don't want to decrease the economy or anything like that.
Why
All
not?
right.
I want to catch that stuff.
So what we're going to do is I'm going to start out this. I don't know. Does anybody have autoimmune disease? You don't have to raise your hand really, but you're thinking about it. You may have questions. We're going to go over it. You don't have to identify yourself if you have autoimmune disease, but you may think about what questions you might want to ask, and we'll try to answer them as best as we can. But first, we want to start out with the videos. And we're going to start out with, this is what happens when you have autoimmune. Then we're going to listen to 4 different physicians. You know, it's hard to know who to trust in this world. And, you know, we play one person's opinion. You're hearing Gregor most of the time. Sometimes you hear someone else. Today, we want to play a number of people because some of you may be skeptical that you can actually change your life. But here's what happens anyway, as a basic.
Let's get into autoimmune diseases, what they are, what they do, and the facts you need to know your body. Here's the breakdown. Our immune system is a network of special cells and organs that protect the body from disease and infection. The immune system can tell the difference between self and non-self, basically what's you and what's foreign. With an autoimmune disease, there's a glitch, and your body can't tell the difference, so it makes autoantibodies that attack healthy cells by mistake. There are over 80 different types that can affect almost any part of the body. Some common ones are rheumatoid arthritis, type 1 diabetes, lupus, celiac, Hashimoto's, and multiple sclerosis. Statistics vary on how many Americans have an autoimmune disease, with the National Institutes of Health estimating 23.5 million and AARDA quoting 50 million. One reason for the difference is how many types of diseases are included in the data counts. Symptoms are as vast as the parts of the body and can include fatigue, muscle aches, fever, depression, and inflammation. It can take a lot of visits to a lot of different specialists to be able to find the right diagnosis. A specialist focuses on treating diseases of a particular system of the body. A rheumatologist treats diseases affecting the joints and connective tissue. A neurologist deals with the central nervous system, and gastroenterologists treat the intestines. The causes of autoimmune diseases remain a mystery to solve, but there are some connecting factors. They can be inherited, so we know genes play a part, and environmental triggers like an infection or chemical exposure can sometimes create an autoimmune response. They're more common in women than men, and some tend to affect certain groups of people. Type 1 diabetes is more common in Caucasians, while lupus is most severe for African Americans and Hispanics. Treatments differ depending on the type of disease, so let's talk to an expert. Dr. Lakshan, what are the treatment options for someone with an autoimmune disease, and is there a cure?
Well, there's not really a cure, but in terms of treatments, we have anti-inflammatory drugs, corticosteroids, antimalarials, and we have drugs called immunosuppressives.
So basically those drugs just keep the body from attacking itself, right?
That's the aim of those drugs.
I've read that diet could impact autoimmune diseases. How do lifestyle decisions factor in?
Well, diet works in 2 ways. Some people think that diseases are actually driven by things that you eat or things that you encounter in your environment. There's no single answer for every patient. You have to experiment.
It sounds like autoimmune diseases play by their own rules, so how can we win?
The best way is to have doctors talk to doctors from one specialty to another to describe and compare and evaluate the patient all as one team.
Thank you, Dr. Lakshan. This has been incredibly helpful, and I hope we've helped you to know your body.
So I'm going to stop there and make just one little comment. If I can figure out a way to...
Let's get into autoimmune diseases.
If I can figure out a way to escape for a moment. So, okay. So there were a lot of good things about the basics of this. Your body kind of has a way of recognizing itself as being yourself. But at some point that breaks down for a number of people. And so the body stops recognizing itself as being normal and leave it alone. And it starts attacking it. It can attack your heart or your lungs or your liver or your joints or your skin. And you know, your body kind of goes on the rampage, effectively, potentially destroying itself over time. So the treatment in the last part of that video, what it was its main focus. The main focus was a list of drugs that are used to suppress the inflammation. Now, they did mention that some people believe that diet and environment may have an impact, but you'll hear from others that diet and environment may be the major factor, and that the use of those drugs may not be what you would want to do as a first choice. Now, maybe it is what you need to do as a first choice, and this is going to be an individual decision for each of you. Should you develop an autoimmune disorder, to make a decision as to, you know, how completely you choose to focus your diet on as being as totally anti-inflammatory as possible, versus taking medicine or doing both for a while and then stopping one, hopefully stopping or reducing the drugs and continuing on with a healthy diet, which helps you in other ways. So this is a decision that you all get to make. So that's all I wanted to comment about that. And I have another video to share, unless Scott, you have some comment.
No, it was good. Good summary there.
Okay, so we're gonna keep going and have some more fun with you. We're gonna listen to Joel Fuhrman and how nutrition can reverse autoimmune disorders. And you'll see Laura Marvis. She's a doctor who's been really promoting whole food, plant-based, and she actually has agreed to come to Nutrition and Medicine, one of the sessions that we need her for, which I haven't decided what we need her for yet, but I'm excited to have her, and she's interviewing Dr. Fuhrman.
To the podcast. I'm Dr. Lori Marvis, and I'm so honored to have Dr. Joel Fuhrman with us today. How are you, sir?
Doing great. Excited to be here and talk to you.
Wonderful. Well, we have two cases from the journal that we want to discuss with you today. The first one is efficacy of a plant-based anti-inflammatory diet as monotherapy in psoriasis. And so I think, you know, there is some confusion as to some people maybe what psoriasis is. Could you give us a little background and just explaining what psoriasis is?
Yes, you know, there's more than 100 different autoimmune diseases where your own immune system is attacking your body in some way. And it's generalized, it's related to a degree of heightened inflammation. An autoimmune disease where you attack your skin and develop skin plaques is called psoriasis, but it can be associated with a disease like rheumatoid arthritis. When you have joint pain plus the skin disease, then it's usually called psoriatic arthritis. In this case we're discussing, this person did have joint pain and psoriasis, so she really had psoriatic arthritis, and she also had Sjogren's syndrome, which is another autoimmune disease that gives you dry mouth and dry eyes and other symptoms. She almost had a lupus type syndrome. Lupus and rheumatoid arthritis and ulcerative colitis and multiple sclerosis are also common autoimmune diseases. And I'm suggesting that in my 30 years of practice, I've had very rewarding and remarkable successes in all those cases, with multiple sclerosis, with lupus, with ulcerative colitis, with rheumatoid arthritis, with psoriasis, and with psoriatic arthritis, inducing complete remissions where people did not have to be sick and have those diseases the rest of their life. And we're using this psoriasis case of psoriatic arthritis case as an example, because most of my 30 years as a busy family physician seeing these people, I didn't keep contact and continue to keep the information to be able to want to write these up and write them up as cases, but I've kept in contact with some of these people, and here's a person that I know now because I think she came to me in 2005 or 2006, so this is about 15 years later, and it was a remarkable case because she was so ill, and she could hardly move in bed for so long, taking drugs for her psoriatic arthritis, and had such a limited life. And then when that year when she got well and got rid of her psoriasis and her psoriatic arthritis completely, she played volleyball, she played tennis, she climbed mountains. She went away to one of her getaways at the Red Mountain Spa, and she put her arms up in the air and said, "Look at me, I'm a miracle." And I said, "You're not a miracle. This is just what nutritional excellence can do for people, that these are inflammatory conditions. And it seems like a miracle because the conventional medical approach is to give people chemotherapeutic agents to suppress the immune system instead of excellent nutrition to remove the inflammation and to allow the body to resolve these conditions." And I'm excited to be part and to contribute some of these cases to the journal, because I really feel that we can definitely, if people they're suffering greatly and they're not being told that there's an option for them to get well here.
Right, absolutely.
All right, so that's one video. Let's listen to the next one. And I think it's Dr. Clapper, this one.
Do you believe that there is a way that a plant-based diet can cure autoimmune conditions?
Oh my, what an important question. When I was in medical school, if I was told a patient has a diagnosis of lupus or rheumatoid arthritis, this is a lifetime curse. They will never get out from under this. We don't know what causes it, but nobody gets better. But science marches on, and in the intervening years, we see a lot has to do with the so-called leaky gut phenomenon. We injure the wall of our intestines, and especially animal products, the fragments of animal muscle and nerve and tendon and all those things you bite into when you bite into a chicken breast or eat a burger. Fragments of animal tissue get into the bloodstream. Antibodies are made against it that then lock onto our own tissues. We get these so-called autoimmune diseases and put these scary names on them. But it has a lot to do with our diet. And now there are many reports in the literature of people who have reversed autoimmune diseases using a whole food plant-based diet and judicious use of other supplements and a healthy lifestyle practice, of course, with enough sleep, reduced stress, etc. So the answers are resounding yes, absolutely. And if people want guidance on how to do this, two places to look. One is go to my website, drclapper.com, and click on answers, and you'll see an article I wrote called Diet, Arthritis, and Uncommon Sense. Oh, I think I changed it, Diet, Autoimmune Disease, and Uncommon Sense. And it details how you can use a plant-based diet to help reverse these autoimmune diseases. And I'd also refer you to the website of my good friend and fellow physician, Dr. Brooke Goldner. She's a practicing, not only she's a psychiatrist, but she cured herself of lupus, which she got when she was a medical resident. She was headed for the dialysis machine. She was in terrible shape with this, but she adopted a whole food plant-based diet and lots of green smoothies with ground up omega-3 containing seeds in it, and goodbye lupus, that she was able to say with a big smile on her face. And in fact, her book and her website have that very same title, Goodbye Lupus. So I suggest you do a internet search on that phrase, Goodbye Lupus. It'll take you to Dr. Goldner's website, and do follow her program. And you too can be one of the many who've walked right out from under a diagnosis of lupus, ankylosing spondylitis, rheumatoid arthritis. Yes, these autoimmune diseases are absolutely treatable and usually reversible with a whole food, plant-based vegan diet. So reason for hope, reason for action. I hope you take advantage of it.
Absolutely. Very helpful and very hopeful.
Hi, everyone. Dr. Michael Clapper here, announcing our new format for.
Okay, and the next is Dr. Greger.
These are the journals I try to stay on top of every month, but now I have a new one to add to the list. The International Journal of Disease Reversal and Prevention, a new peer-reviewed medical journal created to document the science of nutrition and lifestyle to prevent, suspend, and reverse disease with an editor-in-chief no less prestigious than Dr. Kim Williams, Chief of Cardiology at Rush and past president of the American College of Cardiology. I was honored to join their editorial advisory board along with so many of my heroes, and the best part is it's free. Go to ijdrp.org and put in your email to subscribe for free, and you'll be alerted when new issues are out, which you can download in full for free in PDF form. Instead of preventing chronic lifestyle diseases, we doctors just tend to manage them. Instead of curing, we just mitigate. Why? Because of finance, culture, habit, tradition. Yeah, many of us envision a world where trillions of dollars are not wasted on unnecessary medical care. For this reason comes the International Journal of Disease Reversal and Prevention. After all, without data, you're just another person with an opinion. Just to give you a taste, how about pitting plants against one of the most inflammatory diseases out there, lupus, an autoimmune disease in which your body can start attacking your own DNA. Kidney inflammation is a common consequence, and even with our armamentarium of immunosuppressant drugs and steroids, lupus-induced kidney inflammation can lead to end-stage renal disease, meaning dialysis, and death. Unless perhaps you pack your diet with some of the most anti-inflammatory foods out there, and your kidney function improves so much you no longer need dialysis or a kidney transplant. Another similar case is also presented with a resolution in symptoms and normal kidney function, unless he deviated from the diet. Even just cutting out animal products, randomizing people to cut out meat, eggs, and dairy without significantly increasing fruit and vegetable intake, can cut C-reactive protein levels, a sensitive indicator of whole-body inflammation, by nearly a third within 8 weeks. But with lupus, they weren't messing around. A pound of leafy greens and cruciferous vegetables a day, like kale, fruits like berries and lots of chia or flax, and a gallon of water a day. Basically a green smoothie diet to extinguish lupus flares. Note, though, if your kidneys are already compromised, this should be done under physician supervision so they can monitor your electrolytes like potassium and make sure you don't get overloaded with fluid. Bottom line, with such remarkable improvements due to dietary changes alone, the hope is that researchers will take up the mantle and formally put it to the test. Autoimmune inflammatory skin disease reversals can be particularly striking visually. A woman with a 35-year history of psoriasis, unsuccessfully managed for year after year with drugs, suffering from other autoimmune conditions like Sjogren's as well, but put her on an extraordinarily healthy diet, packed with greens and other vegetables, fruits, nuts, seeds, avocados, some whole grains, and boom, before and after. Within a year, she went from 40% of her entire body surface area inflamed and affected down to 0%, completely clear. Oh, and her Sjogren's symptoms resolved as well, as a bonus, while helping to normalize her weight and cholesterol. Speaking of autoimmune diseases, what about the treatment of type 1 diabetes with plants? We'll find out next.
Well, hopefully that wet your whistle a little bit more. But I want to play one more video. It's Dr. Brooke Goldner. She was mentioned by Dr. Clapper about goodbye autoimmune disease. And here's her brief clip, and then we will go back and see if there are some questions.
Welcome, Dr. Goldner.
Thank you so much.
Well, it's wonderful to have you here. So let's start with the basics. Dotsie talked a little bit about autoimmune disease and some facts and figures, but tell us, what is an autoimmune disease?
So you guys are right. Autoimmune diseases are more common than ever before. And what they are really your immune system no longer functioning in the proper way. So when you think about your immune system, the purpose of your immune system is to keep you safe from foreign invaders, right? You get a virus, if you get a bacteria, then your immune system's supposed to create antibodies that attack and kill that invader and keep you healthy. Your immune system also does other things, like if you bang your knee on the corner of the bed, it gets swollen because your body's sending inflammatory mediators there with all the blood and all the cells necessary to repair the damage. So our immune system is really what keeps us intact and keeps us healthy. But when you've got problems with your immune system, which we now know are mediated by an excess amount of inflammation, then the immune system stops functioning properly. And instead of just fighting against foreign invasions like bacteria and viruses, it can start attacking your own cells and your own organs because it can no longer recognize the difference. And that's what we call autoimmune disease. And there's many different diseases, as you mentioned, and some of them can cause things like arthritis, and other ones can actually cause organ failure like lupus, where it can attack your kidneys, your brain, your heart, your lungs, and end up killing people, usually at a young age. Usually pretty young people are affected by diseases like lupus.
So it sounds like crossed wires. Your body starts to not know the difference between healthy cells and healthy tissue and unhealthy. So it's attacking both, but obviously the bad part is it's attacking healthy tissues and perfectly healthy cells.
And actually what ends up happening is the immune system is so out of whack that it can be attacking healthy tissues and not fighting infections. Like I myself had lupus from the age of 16, and I was in kidney failure from lupus, but I had a sinus infection that lasted 6 months because I couldn't fight a cold. My immune system was doing all the wrong stuff, and there wasn't enough of it left over to do the right thing.
But I want to hear your story because it's inspiring, and set you on this journey to being the doctor that you are, helping people with autoimmune diseases. Can you give us a list? Just tell us about some of the diseases that are autoimmune diseases, because I think people might, certainly I might think some diseases are, I don't know whether they're autoimmune or not.
Yeah, there's so many. The most common ones we hear about would be lupus, rheumatoid arthritis, Sjogren's, scleroderma, and multiple sclerosis. And then there's people who have kind of a hodgepodge of symptoms where they might be told they have mixed connective tissue disease, which just means you have some signs or symptoms of multiple different types of autoimmune disease. And then others who are told you have autoimmune stuff, but the doctors don't know exactly which thing it is. And really, in my mind, it's all the same. I don't consider that there's 80 autoimmune diseases. There's an autoimmune process that happens in the body, and which antibodies you develop or which symptoms you get might be helpful for the doctor in terms of what he's billing, right? When we're billing, we need a diagnosis. When we're prescribing a medicine and justifying the medicine, we need a diagnosis. But in terms of the process and how it happens in the body, it's really all the same, which is why I'm able to help people reverse any and all of those really with the same protocol, because in terms of how the body's functioning and where the autoimmune disease is coming from, it's really the same thing, and your body doesn't know that it's filling any certain diagnoses. And that's actually a good thing, that you don't need to have a set in stone diagnosis. If you're just starting to have symptoms, you can still change your lifestyle and your diet and reverse those without ever having known exactly which billing code it would have fit into.
Right. So is Parkinson's an autoimmune disease?
Parkinson's is not considered autoimmune per se. It is an inflammatory condition. And actually, I've had someone with Parkinson's do my rapid recovery program. And that's a 4-week program where you're stuck having to communicate with me every day, and I control your life and everything you eat and everything you do. And he actually did my program because his neurologist was interested in my program and wanted to know if it could be beneficial for Parkinson's. Right. So he was he agreed to do it, but it wasn't necessarily something he would have looked for on his own. And he ate a pretty standard diet, meat and dairy and all those things. And within 4 weeks, his symptoms were so much better that his friends and family noticed how much better he looked, and his doctor was able to lower his medication dosage. And then after he was done with this 4-week experiment, he went back to his previous diet, and he said he quickly went back to the same condition he was in before he started. And that really was eye-opening for the patient to say, whoa, not only did I get better rapidly, but I was able to undo it pretty quickly too by returning to the foods that I used to eat.
So thank you so much for tuning in today. If we helped you in any way.
I'm going to stop right now.
No. They're showing different video clips.
So Jerry, did that answer your question about lupus? Because you had a question in the chat about what is lupus. So it's one of the autoimmune diseases, tends to attack the kidneys and there's lots of different types of symptoms that we see, but like one is a butterfly rash on the face. And so there's all these different markers that tells us whether we think someone has lupus or not. We can do different blood tests and things, but yeah, mainly it affects the kidneys primarily.
Were you able to see the name of the videos? I don't know which video you were looking for, but if you are curious, you can see the names of the videos. The first one is "This is what happens when you have an autoimmune disorder." And the next one is Dr. Joel Furman, "How Nutrition Can Reverse Autoimmune Disease." And then there was "Autoimmune Disease, Treating Lupus, Rheumatoid Arthritis," and then "Anti-Inflammatory Diet for Lupus," and "Autoimmune Disease with Dr. Brooke Goldner." So if you have a camera, you can take a picture of that if you want.
You had Dr. Brooke Goldner at Nutrition and Medicine a few months ago.
Yes, we did. And it was quite an engaging session, and it's on the website that you posted it.
Yep, I have it on there. I can show where that's at. And there's also, if I have time, I can show a video that I highly recommend for everybody that's related to autoimmune disease, multiple sclerosis.
We have time. Let's
go ahead and
just
share
do
my
it.
screen. All right, I'll pull it up here. Let's go right here. There's the home page. And so we'll go go to class archives. You can hover over it or you can click it. And then here it is, Nutrition and Medicine Lectures. So if you click on that under class archives, here's the nutrition and medicine sessions over the past almost a year now. And if you scroll and go backwards from most recent to older, and if you scroll down here, you'll see right here, that was back in February, Reverse Chronic Disease and Optimizing Immune Function with Supermarket Foods with Brooke Goldner. So you can actually watch. So Charlie hosts all these with the medical students and all these different guests. But you can watch that particular one if you're interested in tonight's topic with autoimmune disease. That's a good one to watch. And then let me go to.
Wait, before you leave, there's one more good one. And that's the first one, September 2022, with real people and their real stories. That's our group with a number of people who are sharing their stories for posterity and the medical students, and worth seeing.
Yeah, good point. That is a really good one. You'll see some of the other Dr. McDougall we had on. We had Chef AJ, Dr. Scott Stoll, who's really great with the Plantrition Project. And then we also had Anthony Lim, who's the medical director for Dr. McDougall's program. That was the most recent one.
It was a wonderful year.
It was very, very interesting ones. Let me go back to the homepage and then go up here to videos. So if you click on videos from the top tab, there's one I want to point out to you about autoimmune disease. It's really good. This is Dr. Sarai Stancic. She's a physician, and she developed multiple sclerosis when she was a resident. You know, all the stress of being a resident in your training, you're not getting much sleep and you're working like 18 hours a day and this and that. And she developed multiple sclerosis. But this is actually a lecture she gave at one of the Plantrition conferences. Actually, I was actually at this conference when this was recorded. And so, but it's really good. I really highly recommend it. It's a really inspiring story. She tells her story of how she, when she developed multiple sclerosis and how she was able to put it into remission with diet and lifestyle and the kind of practicing, the kind of medicine she practices now. And so I would highly recommend this video if you haven't watched it already. And then I guess I can also show you, as usual, the different books. So if you go back to the homepage, and then you can see the under the resources, and you can either hover over it and click on books, or just go to the list here, links to books. And so I actually have for tonight's class and next week for autoimmune disease, I actually have Dr. Goldner's book. So Goodbye Lupus was her older one. And then she wrote a more general, more recent one is Goodbye Autoimmune Disease. So it's kind of, even though it's very similar to Goodbye Lupus, it's kind of more generalized to all the different autoimmune conditions. So this is her book. So if you want to check it out, that's there as well.
Any questions from anybody? Thank you, Scott.
Mm-hmm.
We're kind of looking through the room to see if there is anybody who is, you don't have to be shy. Go ahead. Is that Trouty?
Yes. Who's the author of Forks Over the Knives? I like to get that book.
Yeah, it's written by Dr. Alana Poolday and Matthew Letterman. They wrote the actual book for Forks Over Knives, but
what is it? Who is it?
They're long names to spell, but you can just search online. But it's just it's Alana Poolday and Matthew Letterman are the two. They're a married couple. They're physicians, and they wrote the Forks Over Knives plan, that book.
Do they have a lot of recipes in there, or is there other information in there?
There's some in there, but there's also the Forks Over Knives cookbook that's separate.
Yeah, I came across it the other day, and it was around $12, and it was just recipes. And a lot of the recipes I can't take because they have too many things in there that I can't take. I can't take the oils, you know, the different things, and the garlic I'm allergic to, so it doesn't taste the same. Okay, maybe I can get that at the library. I'm going to check that out.
Jerry, hold it back a little bit further from the screen. Little further. Okay, that's more in focus, I think. And then up. And a little more. I'm not sure exactly what that book is. Oh, that's Brooke Goldner, I think.
What's her first name? Goldner?
Brooke Goldner. I just showed her book on the screen a second ago.
Yeah.
What's her first name?
Brooke, B-R-O-O-K-E. Brooke.
Brooke, okay.
Okay, who else has anything that they have a question about or interested in anything? It's not speak now or forever hold your peace. It's like if you have some issue, go ahead and don't be afraid. It's okay. Someone else probably has the same question. You know, we want to make these classes for you, but if there's no one, you know, we have another video for you. And so I'll look around the room one more time, and if I don't see anybody, I'm going to go next to the next video. Okay, so that's what I'll do. Again, you can unmute and just ask a question, or we're here anyway. So I'll play another couple videos. Let's see, why did I wind up here? I don't know. I guess I need to go back to my drive and the autoimmune folder. And now we're going to go into sodium and autoimmune disease, rubbing salt in the wound. This is a Gregor. And then we're going to skip over to potassium and autoimmune disease. So let's see what these issues, how they relate, how the foods you eat, and in this case, the salt.
Millions suffer from asthma attacks triggered by exercise. Within 5 minutes of starting exercising, people can get short of breath, start coughing and wheezing, such that lung function significantly drops. But on a high-salt diet, the attack is even worse. Whereas on a low-salt diet, there's hardly a significant drop in function at all. To figure out why, researchers had them all cough up sputum from their lungs, and those on the high-salt diet ended up with triple the inflammatory cells, and up to double the concentration of inflammatory mediators. But why? What does salt intake have to do with inflammation? We didn't know until now. The Western diet, high in saturated fat and salt, has long been postulated as one potential cause for the increasing incidence of autoimmune diseases in developed countries. The rapidly increasing incidence of autoimmune diseases may be due to an overactivation of immune cells called helper 17 cells. The development of multiple sclerosis, psoriasis, type 1 diabetes, Sjogren's, asthma, and rheumatoid arthritis have all been shown to involve this T helper 17-driven inflammation, and one trigger for the activation of those Th17 cells may be elevated levels of salt in our bloodstream. The sodium content of processed foods and fast food can be more than 100 times higher in comparison to similar homemade meals. And sodium chloride, salt, appears to drive autoimmune disease by the induction of these disease-causing Th17 cells. Turns out there's a salt-sensing enzyme responsible for triggering the formation of these Th17 cells. Organ damage caused by high-salt diets may also activate another type of inflammatory immune cell. A high-salt diet can overwork the kidneys, starving them of oxygen, triggering inflammation. The more salt they gave people, the more activation of inflammatory monocyte cells associated with high salt intake induced kidney oxygen deficiency. But this study only lasted 2 weeks. What about long term? One of the difficulties in doing sodium experiments is it's hard to get free-living folks to maintain a specific salt intake. You can do what are called metabolic ward studies, where essentially lock people in a hospital ward for a few days and control their food intake, but can't do that long-term unless you can lock people in a space capsule. Mars 520 was a 520-day space flight simulation to see how people might do on the way to Mars and back. What they found was that those on a high-salt diet displayed a markedly higher number of monocytes, which are a type of immune cell you often see increased in settings of chronic inflammation and autoimmune disorders. This may reveal one of the consequences of excess salt consumption in our everyday lives, since that so-called high salt intake may actually just be the average salt intake. Furthermore, there was an increase in the levels of pro-inflammatory mediators and a decrease in the level of anti-inflammatory mediators, suggesting that a high-salt diet has the potential to bring about an excessive immune response, which may damage the immune balance and result in either difficulties in getting rid of inflammation or even an increased risk of autoimmune disease. What if you already have an autoimmune disease? Sodium intake is associated with increased disease activity in multiple sclerosis. If you follow MS patients for a few years, those eating more salt had 3 to 4 times the exacerbation rate, 3 times more likely to develop new MS lesions in their brains, and on average had 8 more brain lesions, 14 in their brain compared to 6 in the low-salt group. So the next step is to try treating patients with salt reduction and see if they get better. But since reducing our salt intake is a healthy thing to do anyway, I don't see why anyone should have to wait.
the sodium one. Now let's see what Dr. Greger has to say about potassium and autoimmune disorders.
Potassium is best known for lowering blood pressure and stroke risk, but a randomized double-blinded placebo-controlled trial of potassium supplementation was tried in patients with rheumatoid arthritis, published in the Journal of Pain. Rheumatoid arthritis is kind of the classic autoimmune inflammatory arthritis. Sufferers tend to have inappropriately low glucocorticoid levels, which are circulating steroid hormones like cortisol that suppress inflammation, and so low levels may allow for more inflammation. Glucocorticoids also help our kidneys excrete potassium, and so when we eat a lot of potassium, our adrenal glands secrete more glucocorticoids so we don't build up too much. And so maybe if you gave people with rheumatoid arthritis some extra potassium, it would boost steroid levels and help with the inflammation. So they bumped their daily intake up to 6,500 a day. Still not reflective of our evolutionary heritage, but at least they were making the cut for adequate intake. And indeed, higher potassium intake was associated with an improvement in rheumatoid arthritis and a lower disease activity and pain intensity, reflecting an anti-pain effect for potassium. And so they suggest planning a successful dietary regimen, including much more use of leafy vegetables. Those placed on a plant-based diet experience a significant increase in potassium intake, though even those eating vegan aren't eating enough greens on average. Maybe that bump in potassium helps explain why plant-based diets are so effective at treating rheumatoid arthritis. If this is the mechanism, though, if potassium-rich foods boost natural anti-inflammatory hormones in the body, then it should work for other inflammatory conditions too, right? Well, that's exactly what was suggested recently. Some studies have shown vegetarian diets improve psoriasis symptoms, for example. Maybe this is why speculating a cortisol-potassium theory is a novel mechanism for the beneficial effects of vegetarian diets.
Okay, we're going to stop here, and we're going to see if there are any questions before we keep moving on. Any thoughts or questions from anyone?
I have a question.
Yes,
How much,
Trotty.
how much is too much potassium?
I'm not sure exactly how to answer that. I think it would be hard to get too much potassium if you're eating normal foods or foods as grown in nature. It would be easy to get too much if you were popping a bunch of pills, potassium pills. So we're not advocating you do potassium pills unless that's prescribed by your doctor. And I wouldn't recommend taking more than what you have been prescribed. So I don't have an actual number at this point about too much potassium. You're not going to get too much if you're eating a whole food plant-based diet.
Now, I read in one of the books that you should take the plant-based diet plus the supplements, and that was going with the potassium as well to bring down the blood pressure.
So I don't personally advocate that you take extra supplementation of potassium. I don't know who was recommending that. Were they making money in any way off of what they were recommending? And it's
no, it wasn't
again,
a book.
you must be careful of the sources and who you trust for the advice you're given.
It wasn't a book. I don't.
The only thing I've seen, the only thing I've seen is using potassium chloride to season your food rather than sodium chloride. So, but even then, you have to be careful not to have too much. I mean, it showed, Dr. Greger showed, in kind of in Paleolithic times, we were eating 10,500 milligrams of potassium a day. But when you're getting it from whole plant foods, your body absorbs what it needs, and you're not going to likely, as long as your kidney function is normal, you're not going to get too much, because the kidneys keep the amount of potassium in the bloodstream very tightly controlled, because if it gets too low or too high, it can be very problematic. And so if you're eating mostly all whole plant foods, then you're going to be getting plenty of potassium, but you don't want to be doing it, like Charlie said, from supplements, unless you're told to, because you're on a diuretic or it's prescribed by your doctor. But if you're just, there's not like a magic number of how much you should get. You kind of, as long as your kidney function is normal, you can eat as much as you want from whole foods sources.
Thank you. That takes care of it.
And if you're
sure.
worrying about keeping your blood pressure lower, listen to Dr. Esselstyn and heal your arteries by eating more greens several times a day, chewing them, increasing the nitric oxide in your body. That would be a natural way of lowering your blood pressure. That's greens not once or twice a day, but he recommends 6 times a day.
Oh, wow.
Oh, yeah.
He's
So-
probably right. I understand. Yeah.
Okay.
It's
Je-
too
Jenny.
I have a question over here.
Okay. Jane, and then Jenny will be next. Go ahead.
Okay, I'm here with Jane, and my question is about arthritis. You've been talking about rheumatoid arthritis here just in the last few minutes, and I have arthritis on my toes, which I believe is osteoarthritis. Is there anything about whole food plant diet that can do anything about osteoarthritis?
Yeah, so it's osteoarthritis. It's not considered autoimmune, but it's basically just wear and tear. And if you do an X-ray, you see lots of inflammation and sometimes bone spurs, calcifications, and things. And even though if you went on a completely whole food plant-based diet and exercise and do all the things we talk about, even though your X-ray might not look any different, a few weeks or a few months down the road, there's a good chance that your pain will be a lot better. Your inflammation will be less. And then also, if it's a weight-bearing joint and you have extra pounds to lose, then having some weight loss will also put less pressure on those joints as well. So your answer to your question is yes, it can definitely help even things like osteoarthritis. It just if you have like tons of calcifications and stuff in the joint, that might not ever look any better on an X-ray, but you likely would feel a lot better. I've had many patients that said, "Oh, I couldn't open a jar before, and now I can open a jar, and my pain is less, and my swelling is less when I change my diet and lifestyle."
Great, thank you very much.
Great question.
Jenny. And then Kellyanne. First, Jenny.
Okay, I just have a question. My son has psoriasis. Our son has psoriasis pretty bad, and he's 30 years old. So following a whole food plant-based diet is not something that he's committed to yet, although he's trying. But the studies that are showing the results, are they pretty new with psoriasis? I feel like a couple of years ago when I was looking up how psoriasis is affected by a whole food plant-based diet, I wasn't finding as much related to specifically psoriasis.
Yeah, there's not as much data on psoriasis. I know there is more on rheumatoid arthritis, but it's mostly what we call published case control studies. So like in that journal of disease reversal and prevention, and just anecdotal stories as well. And so just for example, one of the dietitians that sometimes comes to, well, he's part of Eugene Plant-Based Providers. He had psoriasis over 70% of his body, and he also had psoriatic arthritis before he went on a whole food plant-based diet, and he put it in complete remission. He has no more psoriasis, no more arthritis. So there are cases, those are a little bit lower levels of evidence, because it's just individual case control studies, and a lot of those get published and whatnot. But yeah, as far as like randomized controlled trials and higher levels of evidence, there's to my knowledge, there's not a lot on psoriasis, but there is more with rheumatoid arthritis. But then also, like if you read Dr. Brooke Goldner's book or get involved with her, she'll can give you tell you more details about patients she's had more studies, case control studies that can be definitely be helpful. But it doesn't work. It doesn't put every single patient completely in remission necessarily. Sometimes people still need a combination of medications and lifestyle, but it definitely there's no downside to giving it a try.
Okay, thank you.
You're welcome.
Leonie.
Hi, so I actually just wanted to make a comment on the last video that I thought was really, really interesting. So I've been on a whole foods plant-based diet, and that's really helped me control my my eczema. And I thought it was just really interesting seeing the last video on the studies that were done that showed high salt intake can increase inflammation, because I didn't really put 2 and 2 together until I saw that video. But there are certain foods that I'll make or I'll get, and I know that my skin will flare a little bit, or it will be a little bit more sensitive, I should say, the next day. And as I was watching the video, I just realized that, most of them are just high salt content foods, like, a lot of soy sauce, or if you get a soup and you add salt to it, that sort of thing. So I can really vouch for that. Yeah, that the increased salt intake can really make a difference in people who have just higher propensities for inflammation. I don't know how to say that right. But
Well, thanks for sharing that. It's helpful when class members hear from other members. It has really sometimes more of an impact than the videos that we share. So we appreciate that.
yeah, but it is really interesting, because it's significant. I mean, I can feel the sensitivity difference. So I'm going to use that knowledge to reduce my salt intake more. If that helps.
That's great.
Yeah.
Inflammation is, the kind of the key word here.
Yes.
Okay, keep going. You had some other comment.
Oh, I just this is also another random comment, just about skin though. But my son had started having some problems with acne, and I took out all the dairy that he was eating. At school, they were serving a lot of chocolate milk, and so he was getting extra servings of that and stuff. And after he quit drinking milk and everything, all the acne issues and stuff went away.
We've heard that, we've read about it, we've seen people who've been helped by eliminating dairy from their diet, and thank you again for another story to confirm that.
Mhm.
Anybody else care to share? Or have a question? Or anything burning on their mind?
There was a question in the chat about having dry skin, especially at the fingertips, and they said, well, they drink lots of water, so they were wondering what else they could do. I would just say, you may have to use a moisturizer, some sort of oil-based moisturizer, so like Vaseline or Cetaphil or Aquaphor, something like that. And people that have a lot of, have dry hand issues, a lot of times people that have to wash their hands a lot, because fingertips are a really easy place to have dry skin problems. But so I don't know of any diet or lifestyle change that there'd be any studies that show it would do anything for dry skin. But I would just go with, like at night, I tell patients all the time that have dry skin issues on their hands, especially, to get some of those nitrile gloves that you can get, exam room gloves. Essentially, you can buy those at the store. And then I tell them to put at nighttime before they go to bed, coat their hands in either Vaseline or Aquaphor or Cetaphil, something greasy, and then put the gloves on and wear those overnight. And then do that every night for usually a week or two, and that'll really help. And then just having to do that periodically when you start to get the dry skin issues again. But otherwise, if that doesn't work, then you might have to see your dermatologist.
Well, Any other questions? If not, we're getting on to multiple sclerosis next. So we will, again, you can stop us at any moment with a question, just unmute and say, I want to speak. So the next video is treating multiple sclerosis with swank diet. We're going to get into preventing ulcerative colitis and which spices fight inflammation is sort of the next order. Not sure how far we'll get, but we'll play one at a time, stop after each one, and see how far we get, depending on your question. So let's start with multiple sclerosis.
Multiple sclerosis is an unpredictable and frightening degenerative autoimmune inflammatory disease of the central nervous system, in which our body attacks our own nerves. It often strikes in the prime of life and can cause symptoms in the brain, cognitive impairment in the eye, painful loss of vision, tremor, weakness, loss of bladder control, pain, and fatigue. The most frequently prescribed drug for multiple sclerosis is beta-interferon, which can make you feel lousy and cost $30,000 a year, but hey, it might be worthwhile if it actually worked. We learned last year that it doesn't seem to prevent or delay long-term disability. That leaves chemo drugs like mitoxantrone that causes irreversible heart damage in 1 out of every 8 people who go on the drug, and treatment-related acute leukemia. It causes leukemia in nearly 1% of people who take it. But hey, MS is no walk in the park. If only there was a cheap, simple, safe, side effect-free solution that also just so happened to be the most effective treatment for MS ever described. Dr. Roy Swank, who we lost at age 99, was a distinguished neurologist whose research culminated in over 170 scientific papers. Let's look at a few. As far back as 1950, we knew that there were areas in the world that had a lot of MS, North America, Europe, and other places, Africa and Asia, that hardly had any. And now we have all these migration studies showing that if you move from a high-risk area to a low-risk area, your risk drops, and vice versa. So it seemed less genetics and more lifestyle. Dr. Swank had an idea, as he recounted in an interview with Dr. John McDougall at the ripe young age of 84.
It seemed possible to me that this could be a matter of food, because the further north you go, the less vegetarian life is led, and the more people are carnivores, you might say. They spend a lot more time eating meat.
After looking at the multiple sclerosis data from World War II in occupied countries where meat and dairy were rationed, and his famous study in '52 finding the frequency of MS directly related to the amount of saturated animal fat consumed daily in different areas of Norway, he concluded it might be the animal fat, so he decided to put it to the test by restricting people's intake of saturated animal fat. Here's his first 47 patients, before cutting out about 90% of the saturated fat from their diet, and here's after, showing a decrease in both the frequency and severity of MS attacks. Normally, you're lucky if you get people to stick to a diet for 6 months, and so that's why most dietary trials last a year at the most. This is reporting results from the first 3.5 years. Then came the 5.5-year follow-up. He adds another 100 patients. Then the 7-year follow-up, published in the Annals of Internal Medicine. Then the 20-year follow-up, the 34-year follow-up. How did they do? If you can get people early in their disease, when they're only mildly disabled, and restrict their saturated fat intake, Dr. Swank showed he could stop their disease in 95% of cases. No further disability 34 years later. But if they started slacking on their diet even years in, their disease could become reactivated. It felt so great, they were like, hey, I can cheat a little bit. I got this disease under control. but eating just 8 grams of saturated fat more a day was accompanied by a striking increase in disability and nearly tripling the death rate. How about a 50-year follow-up? They were able to track down 15 of the original patients that stuck to the diet, now in their 70s and 80s, with multiple sclerosis for over 50 years. And 13 out of 15 were walking around normal in all respects. They were active and, evidently, unusually youthful looking. Conclusion: this study indicated that, in all probability, MS is caused largely by consumption of saturated animal fat. He thought it was the sludging of the blood caused by even a single meal of saturated fats that can clog tiny capillaries that feed our nervous system. See, diets rich in saturated fat and cholesterol can thicken the blood and make our red cells sticky. A single meal of sausage and eggs can stick our blood cells together like rolls of quarters. And this kind of hyperaggregation can lead to a reduction in blood flow and oxygenation of our tissues. If you put someone's blood through a machine that sucks out about 90% of the cholesterol in their blood, you can demonstrate an immediate improvement in microcirculation in the heart muscle. But what about the brain? Eyes are the windows to your brain. You can visualize in real time changes in blood vessel function in the retina at the back of the eye, which gives you a sense of what's happening further back in the brain. And if you lower the cholesterol level in the blood, you can immediately get a significant improvement in vasodilation. The little veins open wider and let the blood flow. So yes, it could be the saturated fat leading to clogging of our capillaries, but now we know animal fats can have all sorts of other deleterious effects, such as inflammation, so who knows what the actual mechanism may be by which cutting animal fat can cut MS progression. Regardless, patients with MS that follow a diet with no more than 10 or 15 grams of saturated fat can expect to survive and thrive to a ripe old age. Of course, cutting out saturated fat completely might be better, given that heart disease is our #1 killer. The bottom line is that the results Dr. Swank published remain the most effective treatment of multiple sclerosis ever reported in the peer-reviewed medical literature. In patients with early-stage MS, 95% were without progression of their disease 34 years later after adopting his low-saturated fat dietary program. Even patients with initially advanced disease showed significant benefit. To date, no medication or invasive procedure has ever even come close to demonstrating such success. Doesn't cost $30,000, doesn't give you leukemia, and works better. Of course, this all begs one big obvious question. If Dr. Swank's results are so stunningly impressive, why haven't other physicians, neurologists, or centers adopted this method of treatment? Good question. One reason may be that MRI machines weren't invented until the 1970s. MRIs are how we track the progress of MS today. We don't have to rely on patients' subjective reports or doctors' clinical judgments. We can see the disease get better or worse right there in black and white. It's like in the 1970s when Nathan Pritikin appeared to reverse heart disease by the thousands, but no one took him seriously until angiography was invented, and the likes of Ornish and Esselstyn could hold up images like this, proving conclusively that a plant-based diet could literally open up arteries right there in black and white. So what we need is someone to repeat Swank's experiments today with MRI scans every step of the way, and I'm happy to report that exact experiment was just completed by Dr. John McDougall. Dr. Swank was one of Dr. McDougall's medical mentors, and Dr. McDougall is one of mine. Study enrollment was completed last year, and we should have the results sometime soon.
I'm going to stop there, and you've all had a little time to think of a question or two. And so
just to give it away,
Go ahead.
I always comment just to give it away that study. It was only a year long, the Dr. McDougall study, and I can't remember how many patients were in the study, I think around 100 or so. And the results showed that didn't make a big difference in their brain lesions for the patient's multiple sclerosis, but the group was more advanced than a lot of the ones that Dr. Swank had back in the 1950s. And so that's kind of the limitations of the study, where it was more advanced, only a year's time. And then, but the patients did feel they lost weight, they got healthier, they felt better, they had less fatigue. So there was good outcomes, just not not what they were hoping for. They were hoping for a little bit better on the MRI scans, but yeah, those are some of the reasons why. I think why, but it was still a good study, still a good outcome.
I have a question.
Yes.
Which gender is likely to get MS? Because my first husband had it and died from it. And then I had a female friend that had it, but I've heard recently that's usually women that get it.
I think women are slightly more likely.
Ah, okay. That's hard.
Any other questions?
I have a dumb question.
Yes, Trouty.
What's a PhD?
PhD?
What's the title, the normal title for that?
You mean what do those letters stand for, or is it? It's a doctorate degree.
Physical doctorate. Yeah, physical doctorate, I believe, is what that stands for.
A physical doctor?
No, it's a doctor of philosophy.
Doctorate.
A what?
Doctor of philosophy.
Doctor of philosophy.
Oh, philosophy. Yeah. Okay. I
actually didn't know that.
I got that a lot.
And I'm 74. I haven't figured it out yet. Thank you for asking the question.
It wasn't so dumb after all, I guess.
No, it wasn't a dumb question.
I thought everybody knew except me. Okay.
Yeah, professional. Yeah, doctor of philosophy or professional doctorate is the other meaning.
Does anyone else want to chime in on this topic, or have any other questions or anything before we proceed on? We have a few more minutes. Okay, well,
I have another question.
Go ahead.
Dr. Swank, did he write a book?
I don't think so.
I think so. He has published papers, but yeah, he worked at OHSU in Portland, so he was chief of neurology up there for a lot of years.
Mm-hmm. Okay, yeah, I was wondering about that Swank diet.
There's a Swank diet book, but I don't think he wrote it. I think he did the research, but I don't think he wrote the book.
What's it called? The book, the title?
The Swank Diet.
Oh, okay.
Thank you,
Eric. But you already know what it is. A whole food plant-based diet.
Yeah.
Maybe not quite as strict, but maybe not quite as strict as what we're teaching here, but that was a lot of years ago. They didn't have all the benefits of all the science that we have now.
Who's the author of that book?
I have no idea.
Okay, well, I'll find out.
The next video we're going to share is preventing ulcerative colitis with diet. So we're going to the GI system next.
What has driven the dramatic increase in prevalence of the inflammatory bowel disease, Crohn's disease, in societies that are rapidly westernized, a disease practically unknown just a century ago? What has truly changed in our internal and external environment that has led to the appearance of this horrible disease? Well, Japan suffered one of the most dramatic increases. And of all the changing dietary components, animal protein appeared to be the strongest factor, an exponential increase in newly diagnosed Crohn's patients and daily animal protein intake, whereas the more vegetable protein, the fewer the cases of Crohn's, which is consistent with data showing a more plant-based diet may be successful in both preventing Crohn's disease and in treating Crohn's disease. But what about inflammatory bowel diseases in general? The largest study of its kind, 60,000 people followed for over a decade, found that high total protein intake, specifically animal protein, was associated with a significantly increased risk of the other big inflammatory bowel disease as well, called ulcerative colitis. Not just protein in general, the association between high protein intake and inflammatory bowel disease risk was restricted to animal protein intake. And since World War II, animal protein intake has increased not only in Japan, but also in all developed countries. This increase in animal protein consumption may explain some of the increased incidence of inflammatory bowel disease in the second half of the 20th century. And it's not just this study, that's about what most other studies found as well. But why? I mean, what's the difference between animal protein and plant protein? Well, animal proteins tend to have more sulfur-containing amino acids, like methionine, which bacteria in our gut can turn into the toxic rotten egg smell gas, hydrogen sulfide. Emerging evidence suggests that sulfur compounds may play a role in the development of ulcerative colitis, this chronic inflammatory bowel disease of the colon and rectum characterized by bloody diarrhea. The first hint as to the importance of our gut flora in general was in the 1970s, when analysis of stools showed that their bulk was made up of mostly bacteria, not undigested material. Most of our stool by weight is pure bacteria. We're pushing out trillions of bacteria a day. They just keep multiplying and multiplying, and they do wonderful things for us, like create the protective compound butyrate from the fiber we eat. But it depends on what we feed them. Bacteria may also elaborate toxic products from food residues such as hydrogen sulfide in response to a high meat diet. Hydrogen sulfide is a bacterially derived cell poison that has been implicated in ulcerative colitis. We'd always assumed that sulfide generation in the colon is driven by dietary components such as sulfur-containing amino acids, but we didn't know for sure until this study. They had folks eat 5 different diets, each with escalating meat content from vegetarian all the way up to like a steak a day. And the more meat, the more sulfide. 10 times more meat meant 10 times more sulfide. They conclude that dietary protein from meat is an important substrate for sulfide generation by bacteria in the human large intestine. Hydrogen sulfide can then act as a free radical and damage our DNA at concentrations way below what our poor colon lining is exposed to on a routine basis, which may help explain why diets higher in meat and lower in fiber may produce so-called fecal water that causes about twice as much DNA damage. Fecal water is like when researchers make a tea from someone's stool. The biology of sulfur in the human gut has escaped serious attention until recently. Previously, it was just thought of as the rotten egg smell and malodorous intestinal gas. But the increase in sulfur compounds in response to a supplement of animal protein is not only of interest in the field of fletology, which is the formal study of farts, but may also be of importance in the development of ulcerative colitis.
So that brings us close to the end of this session. Any questions about that? I'm going to stop sharing. Any thoughts from anybody? And if there's no one who's going to speak up, I'm going to talk about the question for the week is, what is alpha-gal syndrome? Anybody in the
Everybody.
group read about that or heard
I-
about it?
I think I did a little bit.
You want to give it a try as to what's going on?
Sure. If I remember this correctly, is it like an allergy to meat based on tick exposure?
Yeah, so good for
Okay.
you. It's actually the Lone Star tick, which has
The
a
lone-
little white dot on its back that looks like a star. So it's a Lone Star tick. And from its saliva, when it bites into you, it introduces a sugar. And that sugar is called alpha-gal. Okay, now the
Nice.
body attacks that is a foreign object. Other mammals have this, but humans don't. And it's associated with the meat. And so when you're eating meat or sometimes dairy, other animal products, you develop this allergy reaction, but it doesn't happen immediately. It's not like eating peanuts and all of a sudden your throat is tightening up. It can happen 6-8 hours later. So you don't recognize this association. And then every time you're eating these animal products, you're coming up with these weird symptoms. What? Bellyache and nausea and vomiting or whatever it might be. No doctor can figure out. So you either have an autoimmune disorder, or you've got fibromyalgia, or you've got neurosis, hysterical disorder, Munchausen syndrome, where you're just trying to make this up. No one knows what to do, and you've been going to one doctor after another doctor after another. Just another good reason to avoid all animal products.
Yeah.
I couldn't resist bringing that up for the group. Anybody have some extra thoughts on that?
Yeah, so it's alpha-gal stands for alpha galactose, and it's only in mammals, so not in humans, but only in mammals. So it's not in fish or birds. So so someone would potentially still be able to eat fish and chicken, but because they don't have alpha-gal in them. And it doesn't happen every time you eat it either. I guess it's inconsistent, so it makes it difficult. But you can do a blood test for antibodies to alpha-gal, so you can check for alpha-gal antibodies, and they're recommending that if somebody thinks somebody got bit by a Lone Star tick and they're suddenly having allergy symptoms, hives, and all the symptoms you described after a few hours or so after eating any other mammal, and then you can check for this antibody. And then there's no cure. You just have to steer clear of eating other animals.
Thanks for sharing that, Scott. And I'm going to go back to the gallery and look around. Is there anybody who's having difficulty with a transition to a whole food plant-based diet or lifestyle? If you're having any sort of difficulty, then send us a message, and we want to hook you up with a med student to kind of provide some support to help you on your path. So don't be shy. Just let us know, and it will also help the med student. So Nancy.
Yeah, well, going back to the previous question, this trip I was just on, this girl, she became vegan, she said, because she just having stomach upsets and stuff like that. And somebody told her to stop eating meat. And she said within 4 days, she started feeling better. And so she's vegan, and I don't know, it seemed kind of strange, but it was interesting. And I was this alpha-gal thing, maybe, who knows? But anyway.
Yeah. So may you see her again, and you could mention it.
No, well, I can email her.
Yeah,
but,
there you go.
So I have a question which is kind of out of the realm of this.
That's okay.
Because my brother he's going to be going on dialysis. And I was just curious whether, you know, if you can go off dialysis if you eat a whole food plant-based diet, or, you know, I mean, he's kind of resistant to going whole foods plant-based, but I was just wondering if it could, quote, cure your kidney disease.
I have seen about 4 patients who have improved their kidney function from a glomerular filtration rate in the 40s up to above 60 on normal range. I haven't seen anyone who's been on dialysis actually change their diet. They're usually in such poor health that everyone is feeling like, well, we wouldn't want to force them to eat food, change their taste buds or whatever it is, and make their lives miserable by forcing them to change their diet. So I have not seen one person who's made an attempt. I haven't seen any studies that show you could get off of dialysis, although Brooke Goldner, I believe, was on dialysis as a teenager, and she was able to get herself off. So there probably are cases. Scott or Eric, do you know of any dialysis people who have been able to get off of dialysis?
Yeah, I don't know of any, but it's you know, I'm sure some of it would have to do with why, you know, what's the cause of the kidney failure, whether if it's diabetes, you know, something that could be potentially reversible, or if it's, you know, autoimmune, you'd have to, you know, put the autoimmune condition in remission. You know, there's lots of different reasons why someone would be on dialysis, but I've had a patient went from a glomerular filtration rate of 18 up to 44 in like 6 months, and so 18 is getting down to where you're just about ready to go on dialysis, and in 6 months went up to 44 on a whole food plant-based diet. But the other thing that's really important, if somebody is that severe of kidney disease and they want to change their diet, even if it is to whole food plant-based, they have to work with a renal dietitian. They have to work with a dietitian that specializes in kidney failure, because there's a lot of things like potassium and phosphorus, magnesium, a bunch of different things you have to really monitor closely if you're going to change your diet drastically.
And that's another part of the problem. The people who have been that I've interfaced with, the dietitians who are with oncology and nephrology, they tend to be working under the old system of dietary recommendations as opposed to the latest science on nutrition. Now that may be changing, but it hasn't in my experience so far.
I have a question.
Yes, Trotty.
What restaurant that is vegan or vegetarian here in Eugene would you recommend? I eat out a lot with friends.
So I don't recommend eating out a lot anywhere.
I have to.
I recommend eating out occasionally, and there are some restaurants that potentially you could eat at. There was a kind of a, I don't know whether it was there was some sort of bowl at the Laughing Planet, was fairly healthy.
What was it called? Laughing Planet?
Laughing Planet. They have some fairly good choices there. If you eat at the Yum with putting the Yum sauce on the side and not eating a lot of it, it's filled with a lot of oil and high calorie food, but the beans and the rice and the other things they put in there are usually pretty good.
Where's
So
that
Yum restaurants, YUMM, that's what we ate at for a long time. And then there's the Scott, you've been to the Acorn Cafe. You can kind of talk about that and whatever.
Yeah, Acorn Cafe is right across the street from Laughing Planet. Laughing Planet's on Monroe Street. They're about 8th and Monroe, and then right across the street is Acorn Cafe, so you can look that up too. But there's other vegan options at different restaurants around town. I mean, There's
they
lots of
still
places you can get.
you know, at least we have some way out here instead of me eating the Mexican food that doesn't just go. Last time I got pretty sick with it, so I got the chest pains with it. No good. I don't eat the Mexican food no more. So that's pretty good. That helps me out.
There's also a food truck called Peaceful Palate. He had some pretty tasty options, but he's kind of hit and
What is
miss. Peaceful Palate. It's a food truck in that area.
Food truck. Okay. Well, they like to sit down, you know, so
that
yeah,
won't work.
We'll check it out. There's enough situation where we can get something. Yeah.
Okay. Well, we've gone a little bit over time, but we've
you.
had fun, hopefully. And we are grateful for all of you and look forward to seeing you. What's next week?
Same
Scott?
thing, part 2. You probably have some more videos. We could talk more about arthritis and thyroid health as well, which, thyroid health, we alluded to it earlier with Hashimoto's thyroiditis. We could talk more about that, which is a type of autoimmune condition that suppresses the thyroid. But we can, I see you still had some more videos there for next week.
Can you get off from the thyroid medication?
If you don't have
Sometimes you
enough
can.
iodine in your diet, you can get off. But if you have an adequate amount of iodine, probably not.
Okay. Well,
We
I
can-
can't deficient all that stuff. That has
We can
all
talk.
that.
We can talk more about that next week too.
Yep. We'll talk about it next week. All right,
Okay, thank
everybody.
you.
Scott, thank you very much. Eric, thank you very much. Eliani, thank you. And
Thank you.
all the rest of you for your questions. It's been fun. Till the next time.
Sayonara.
All right.